Hey friend, how's it going? Today I'm going to give you an inside look into the therapies that I am doing to help heal my super tight pelvic floor. This is what it looks like to be on the inside of pelvic floor therapy, trying to make pelvic dysfunction work better. And it's the opposite of everything that you typically hear when it comes to caring for your pelvic floor. I'm Katie Huey Harrison, founder and editor-in-chief of Undefining Motherhood. We're an educational site and community equipping you to do this mom thing your own way. And I have been really stunned as I have healed from prolapse surgery. This is 3 months post-surgery today. I just had both pelvic floor physical therapy and my post-op appointment this morning. And let me tell you, we're doing a lot to help my recovery. But there were some things that have come up that I was really not expecting and really not prepared for. So in this conversation, we're going to have a very candid chat. So this is the right place for you if you are comfortable with me talking very explicitly about things that are going on in my pelvic area. And specifically, if you're looking for information that might be relevant for you, if you're considering prolapse surgery, if you've had prolapse surgery, or if you have a tight pelvic floor, tight pelvic muscles, then this is for you. So I have always had a tight pelvic floor. Typically, if you hold tension in your jaw or in your shoulders, it's likely if you're clenching those, you're also clenching in your pelvis. So do a quick check-in right now. Take a breath. Feel your jaw. Is it clenched? If it's clenched, unclench it. Feel if your shoulders are up. Let them down. And then we hear about these check-ins, right? But where we don't often check in with your pelvis. Was it clenched too? There's a good chance for a lot of us that it was if you're someone who is clenching up here. And this is one of the reasons that some of us are more prone to having hypertonic pelvic floors, which means they're really, really tight. So usually when we talk about needing to support our pelvic floors, what we hear is do Kegels. How many of your OBs have told you to do Kegels during pregnancy or after baby was born? And that could potentially be good advice. The issue is, if you have a hypertonic pelvic floor, then when you do Kegels, what you're doing is worsening the problem because you're tightening those pelvic muscles so much more. So I am not an expert on pelvic health, and I'm not going to pretend to be, but what I do want to do is tell you what I'm learning based on the experts I'm working with that are helping my body. I had a hypertonic floor before prolapse surgery, and that seems a little counterintuitive, right? You have prolapse, but your pelvic floor is too tight. But if you think about it, when everything is pushing together, a lot of times it pushes down. So I had a bladder prolapse and a rectal prolapse, and my surgery repaired both of those. Now, my surgery recovery was more intense than we had anticipated it being because the doctor also found that I had a detached muscle that had to be repaired. So it's been a really intense surgery recovery. And it took until about 7 weeks post-op for me to even be able to comfortably sit in a car. So we were dealing with something special here. My body's response to that was to clench up so much more. So something that the doctor told me after surgery, not before, was she said intercourse can be uncomfortable for up to 6 months after prolapse surgery. Nobody told me that before. I think they should have. I think that's information you deserve to have. So if you're considering it, know that it could be uncomfortable for up to 6 months after prolapse surgery. But here's the reality. I am 3 months post-op, and right now it is still completely impossible. So I'm just going to give you a quick visual. This is an applicator for one of the products I'm currently using, and I'm going to tell you about that. This is my hand for size reference. Until this week, I could not fit this thicker edge of the applicator, like the size of my thumb, into my vagina. That's how tight things were. It's not that I was sewn up improperly. It's nothing to do with the surgery. It is muscles that are just so clenched. So I'm working with both my urogynecologist and my pelvic floor physical therapist to figure out how to loosen things up and make things more relaxed. And it's already just in the past week of making some major changes, working wonders. So I'm excited to tell you about those things so you have some ideas of what you can expect or what you can ask about if you're struggling with this. So the first thing that I'm doing, and this is what this applicator is for, is I'm doing Valium suppositories. Have you ever heard of such a thing? Well, you have if you've been watching this YouTube channel. The Valium suppositories are really kind of cool because it's a suppository that you insert vaginally before you go to bed. You leave it in overnight, and it puts Valium, Valium makes you calm. It puts it into your pelvic muscles, and somehow it relaxes those muscles without getting into your brain. I don't feel the effects of it. And I have anxiety. I have taken anti-anxiety medications plenty of times in my life. I know what they feel like, but I'm not feeling the effects of the Valium at all. So it's super cool. So this is what that looks like. The suppositories come in this little packet. And you just peel one off and you open it up. And so you've got this tiny little, you can see what that looks like here. It's just gel. Is what you're getting in here. There's just a little gel tablet. And what you do is you stick that gel tablet directly into this applicator, and then you just insert the applicator as far as you can get it into your vagina, and you push it up. And that releases the gel. You stay lying down, and it's going to help get your pelvic muscles to be a little bit less rigid and tense. So it's recommended for a lot of people to do this daily for 30 days. I cannot do it daily because I'm breastfeeding. So my advice from a postpartum psychiatrist who I've been working with, who's helping me with the dosing of this, she was like, I'm really only comfortable with you doing this once a week. So if you're using this and you're nursing, talk to your care providers, come up with what works for you and your body. But I'm only able to use it once a week. So what I'm doing in conjunction with both my physical therapist's advice and my urogynecologist's advice is I'm using the Valium the night before pelvic floor physical therapy. So I'm doing pelvic floor PT weekly, and I'm also using the Valium suppositories weekly, and I do those at the same time so that when I go to PT, my muscles are a little more relaxed, so it's easier for my pelvic PT to manipulate that tissue and help to get it to release. Because when you're working with a hypertonic pelvic floor, meaning it's really tight, when you go to pelvic PT, a lot of what happens is actually your PT having like their fingers and gloves inside your vagina, manipulating the tissue, trying to get it to loosen up. It's honestly not uncomfortable. It just kind of, you get used to it. I don't even think about it anymore. So those are some things that I'm doing. Now, let me tell you some new additions, and this is where I'm really seeing the needle moving. So I'm super excited about it, even though it's kind of weird. So when you do pelvic PT, I'm going to use my little vagina here to help you, or my vulva, I should say. This is the vulva. So this part right here is the vagina. So if this is where your anus is, then this is the perineum. This is what we worry about stretching when you have a baby. And this is where the incisions were to do the surgery. So this area is super duper tight. So for me, the right side of my vaginal wall, and then the back side of it and this perineal area, that's where I'm having the hardest time with just intense tightness. Like if you imagine, if you stick this applicator inside your vagina and your vagina literally just grabs it and holds it, like it grabs it. That's what my muscles are doing. So we're trying to release that. So what my pelvic floor therapist has me doing is she has me using dilators. And I'm going to show you these dilators. They're hilarious. Forewarning. This is it. This is the guy. So this is from a company called Intimate Rose. And basically what you do is you insert the dilator with lubricant. So you want to use a water-based lubricant. So this is one from Intimate Rose as well, because traditional sexual lubricants can erode the silicone in the dilator. And believe me, this is not a thing for pleasure. This is a thing for solving some anatomical issues. So what you do is you stick the dilator here, so you can see, in that vaginal hole, and then you're going to use whatever instructions the PT gives you. So I would recommend having a PT for this if you're in this situation. But for me, it's pushing down, side, side, down, side, side, and slowly over time also just learning to breathe with it in. So I literally stick this in and I keep it there for about 15 minutes, just deep breathing, going about my life, letting those muscles remember, hey, it's okay. You can do this. You don't have to be super clenched all the time. I've been doing this for 1 week, and let me tell you, TMI, I don't care. I'm here to be real with you. Last week, when I tried to put the Valium suppository in, I could not use this applicator. It would not physically go inside of me. So I had to use my finger to put the Valium suppository in. Then I went to PT the next day. I have used a dilator 5 out of the 7 days since then. And today, or last night when I needed to put the Valium in, this super simple, no problem, went in just like it would have before my surgery. I'm not back to where I was before my surgery, but this is huge. We've also added a new layer that I'm pretty excited about. My PT asked me to talk to my urogynecologist about it, so I did today. Oh my God, I'm like holding this and talking with my hands, you guys. Sorry, whatever. I'm gonna put that down now. My PT told me to talk to my urogynecologist about Lidocaine gel. So the urogynecologist just called that in, and what the Lidocaine gel will do is it's something that I can actually use as a lubricant with the dilator, and I will hopefully then have less discomfort, so it will be a little bit easier for me to use the dilators and to do any of the stretching that I need to do. And I guess I'll probably also take it to pelvic PT with me. She didn't tell me to, but why not? And see if she wants to use it there, because it might give her more ability too. So my urogyne just called it in, so I'm going to pick that up later today. So I'm really excited to try these different things. Now, I do want to show you one quick thing before I wrap this up, because if you are considering doing something like going to Intimate Rose and using their dilators, they also make a pelvic one. They have a lot of things that are really great for a hypertonic pelvic floor. But I really want to encourage you to see a physical therapist and find out what you need for your specific situation, because we do want to make sure we're making things better, not worse. So what I want to point out here is different sizes. So these are sizes 3, 4, 5, and 6. And they go up to like 9 or 10, I think. So my PT had me start with a size 5 dilator. That is what I am using every day right now. And then eventually our goal is to get up to a size 6. I don't know if she plans for me to go past that. I think at some point you probably don't actually need to expand anymore. But making sure you're sizing this with someone who is basing it on your body and your needs is really, really important. If I were using the wrong size, it would be extremely painful. And you know what happens when we have pain? We clench. So it would actually be doing more harm than good. We have a lot of different things that we're doing to work together, to put these things together to have a big impact. There's the Valium helping me relax for PT. There's the PT and that myofascial release itself. There's the dilators and the lidocaine to help me get a little bit more leverage out of the dilators. A lot of this is working together. So if you are struggling with a hypertonic pelvic floor, with feeling like your pelvis is clenched, if you've been trying to do Kegels, but you find that you're peeing yourself more, that might be a reason to suspect a hypertonic pelvic floor. These are all reasons to then try to seek personalized pelvic PT. So it's available privately most places, but if you're trying to access it through insurance, most gynecologists can recommend you to go see some sort of pelvic PT. You may not be able to go as often as if you're doing it privately, but this isn't necessarily something you have to do all the time. I think, yeah, the more often you do it, the more you're going to be able to move that needle and faster. But really, if what you need the most is to get your hands on the right tools and products and methods, you need an appointment for someone to size you, to say, hey, here's what I think you need. And then you can follow up just like you would with any other doctor or medical care provider. So I know there was a lot to this visually. I hope that it has been helpful for you. Thank you so much for joining me today. I'm curious to hear from you what questions you have about treating my pelvic floor dysfunction, hypertonic pelvic floor, prolapse surgery. Drop any questions that you have below. And of course, if you found this content helpful, don't forget to like and subscribe. I'll talk to you soon, friend. Bye.